We primarily focus in Istanbul in Turkey. I graduated from University of London in 2003 with a degree in genetics and genetic engineering, followed by a master's in regenerative medicine and medical biochemistry, followed by a 6-year degree in medicine, and then another 5 years in complement and functional medicine, specializing in stem cells. When combined with stem cells, of course, is behavioral analysis, occupational therapy, speech therapy, physical therapy. All these therapies work to minimize the impact of the core features and associated deficits with autism. I think it's a combination of the current medical research and the fact that so many patients and parents have seen the effects that mesenchymal stem cells, in particular umbilical-derived mesenchymal stem cells, have had on their children. So I think it's more word of mouth more than an increase in any kind of awareness. What we've seen time and time again is that the younger the child, the more pronounced the effects of the treatment are. Again, this is down to the remodeling or the infrastructure of the brain itself being a lot more malleable, a lot more easier to change the younger the patient is. And yes, we do have a cutoff for treatment. We generally say 14, 15. And why we say that is because after a certain age, the effects are less pronounced. We do see some positive effects, but they're not as dramatic as if the patient was, say, 5 years old, 6 years old. Again, it's down to the fact that over that period of 10 years, 12 years, the infrastructure of the brain, the modeling of the brain itself has almost become permanent, the structure. So the earlier we treat, the more malleable, the more pronounced the effect it would be. There have been patients where we said we can't treat, or we don't think that the treatment will be very, very effective. So it depends on the patient and also on the patient or the child. We have to evaluate if even with stems, would it be effective? Do they have cognitive therapy? Are they having any kind of speech therapy, or what is their home life and social situation like? These are all factors we take into account. Also, does the patient or the child have any kind of extra illnesses? Some of our patients are not just autism patients, but they have associated neurodevelopmental disorders or metabolic disorders, things like that. We have to evaluate each patient individually, and sometimes, sadly and unfortunately, some of our applicants are just not suitable. The intravenous infusion, where we open a small IV cannula and we give 2 infusions per day. One will be stem cells, one will be exosomes, which I'm sure we'll discuss a bit later. Yes, some of our patients, because of the nature of their disease, can be disruptive or confrontational. Some of them can physically want to pull out their IV access. We have over 20 departments. We have pediatric neurologists, pediatric anesthetists, pediatricians, of course. It depends on the patient, and beforehand, while discussing it, once we've decided that the patient is suitable for treatment, some of our patients, a small amount, have pseudoanalgesic, which is a type of very light anesthetic medicine to put them a bit sleepy, so we can open the IV access, so we can give the treatment. Some patients are quite happy having the IV access, and they sit in the arms of their parents in the hospital bed. And the procedure takes anything from 30 to 40 minutes per infusion, and there's two infusions. After the treatment, the IV cannula is taken out. The patient is observed for a period of time, and then discharged from the hospital. It's a day patient, so they don't need to stay. Of course, we've had patients which have needed to have other physical requirements and may need to stay in the hospital overnight. But generally, all of our patients are what they call day patients. They come to the hospital, they have their vitals, they have their blood pressures and their pulses and everything examined. Um, they get calmed down in their private hospital room. The IV access is opened up by our team of experienced pediatric nurses, and then the infusion is started. Sometimes we do this in a anesthetic setting, where instead of being in intensive care, it is what they call um, uh, semi-intensive care, where it's a special area where the anaesthetists use sedation to sedate the child so they can give the treatment. So again, it's patient specific. 99% of all our patients are given allogeneic allogenic mesenchymal stem cells. And these are all materials donated by mothers who have given birth. It's derived from their placenta and their umbilical cord itself. So it's all donated material. We're in the first day of treatment. The patients have a change in their eating, they have the change in their sleeping. After the second and third day of treatment, we've had patients that are beginning to be more acclimatized to crowds. In fact, even constructing sentences consisting of 2 to 3 words as opposed to just no words, or singing, for example, or pointing to things. So it's quite dramatic, in fact, and the effects continue to increase over the next 3 months. In combination with educational therapy and speech therapy, the effects are a lot more dramatic, and they continue to show. Medical diagnosis of autism or ASD. We'd like to see that the patient has been evaluated, and also blood-wise, for a medical requirement, we just like to see PTIR. It's a type of blood clotting test because we're doing IV. So we have to see if there's any kind of blood problems, because very rarely some children, unknown to the parents and even their own medical doctors, sometimes they have blood disorders. So just to make sure that everything is above board, we expect to see PTIR, which is a type of blood thinning test, and of course your standard hepatitis and HIV tests, because we have to make sure that all patients from other countries that take IV treatment, it's a legal requirement by the Ministry of Health. We get sent short clip videos of the child either playing on their own or putting on their jacket so we can see how their movements are, or eating, or in a class setting. Sometimes we get videos in a class setting where we can see how they interact with their teachers and their students themselves. So it's a combination of blood tests, physical paperwork, and videos. We've had family members call us up or email us. We've spoken to them on the WhatsApp about situations like this. Sometimes, of course, without knowing 100%, this is all supposition. But we have our suspicions that some of these clinics, especially in Mexico and in Panama, are giving substandard stem cells, or not even stem cells, or stem cells which are not viable, that have died. it depends on the quality and the vigor and the efficacy of the treatment of the stem cells themselves. This is why we've been so successful, because we have in our partner StemBio, which is a government approved bio facility within a government sanctioned science park. It is a over 20,000 meter squared science facility that produces exosomes, stems, and other biological medicines. They are full GMP, GCMP accredited and approved, and they have licensing both from the European Accreditation Society and also from the state Ministry of Health and the state Ministry of Science. Because of this, we've seen that every time that we use StemBio and our stem cells, the effectiveness and the treatment outcome is so much better. Again, if the patient has had stem cells before, the question that we always ask is where and how and when and what type of stem cells, because not all stem cells are suitable and not all stem cells are viable. So again, it's like saying I had a burger at one place and it wasn't very good. Can I have a burger again? It depends on where you got your stem cells from and what type of stem cells. Full medical hospital with full staff of anesthetists, pediatricians, neurologists, pediatric nurses. We have, God forbid, we have intensive care. We have operating theaters. We have everything in the hospital. What's included is the treatment, the medical following, and the post-treatment care. Of course, we give stems and exosomes, but also when the patient leaves the facility, which contains close to 1 billion exosomes. These exosomes are what drive the stem cells and what cause the stem cells to have the positive improvement on the body themselves. By giving intranasal application of the exosomes over a period of 7 days post treatment, we increase the efficiency of the patient's treatment. So we give exosomes IV stem cells, close to 1.5, 1 million, depending on the disease, per kilogram of the patient's weight every day, followed by exosomes, 1 billion exosomes every day. And then on discharge, they're given a 7-day treatment of intranasal exosomes, which can cross through the ethmoid sieve, which is a kind of like little microscopic holes behind the skull, straight the blood-brain barrier straight onto the brain itself. So it's very, very effective. Do not waste your time and your money. That's all I can say. If you're going to go for the cheaper option, and I understand it is actually quite fiscally demanding, financially demanding, not only the treatment, but having to take time off work to travel to a foreign country, for example. These are all factors which do contribute to people's decision making. I can understand quite easily. But in short, I mean, do not go for low quality. If you have any doubts, don't do it. If you should always have follow-up questions. If they don't answer your questions or you have any doubts, you shouldn't do the treatment.